everyone, and thank you all for coming, and thank you Tara and everyone at HSR UK for doing so much work to make this event happen. As Tara said, my name's Deborah Fenney and I'm a senior researcher at the King's Fund. So just to remind you, when you registered, we asked what you'd like to get out of the session. And here are a few quotes. So just have a little read of those, finding out about inclusive practices in research, would like to get involved in projects as a peer researcher, listening to public contributors. I think there's some common themes among these and among the responses that were submitted. There's a desire to learn how to improve inclusive practice in research and how to get involved in this kind of research. So at the King's Fund, we're on a continuing journey to make our research more inclusive. We're currently exploring how we best use lived experience as a guiding principle for our work, and how considering diversity and inclusion as an organisation changes how we approach our work. And none of these issues are new. But the pandemic really spotlighted the consequences of not paying enough attention to diverse needs. For those of us who are involved in research, the opportunity that we've got is to produce findings that really influence how people think about these issues. But the challenge is also that researchers have to develop their own thinking and practices to do this kind of work. And I think everyone attending today has experience of either doing research or taking part in research, and potentially of experiencing barriers to conducting inclusive research, or being excluded from research, or having our experiences ignored, minimised or dismissed. So I'm really pleased that we're able to use our time together today to hear from some people who are doing innovative work or simply doing inclusive research well, to gain inspiration and ideas that we can take back to our own contexts, and as well as talking with each other to identify some of the common issues and challenges that we face, which need addressing at more systemic levels.
First of all, it's helpful to think about what social inclusion actually means when we're talking about inclusive research. What do we actually mean? And looking at a number of different definitions of social inclusion, I think in terms of research and inclusion more generally, we're thinking about improving the terms on which in groups in society that experience disadvantage participate in society or participate in research in this case. And how that can be done through enhancing opportunities, improving their access to resources, making sure that their voice is heard, and respecting their rights. And all of those things are done in ways that actually help to redress the imbalance that they currently face, where those opportunities are not often available, resources are limited for them, voices ignored or not listened or not actually even acknowledged, and rights are not respected. And also to understand what we mean by social exclusion, that this is created and maintained through formal institutions in society, like research institutions, like many of the institutions and organisations that we all belong to, or many of us belong to, including research organisations like universities and other institutions, and organisations that might recruit for research, for example. And all of those institutions and organisations are maintaining processes that keep exclusion in operation, that contribute to exclusion. And what we found was that those drivers of exclusion operate at three different levels: what we might call the macro or socio-political level, the meso or institutional level, and the micro or individual and community level. So in terms of what we can do about this, we need to think about solutions at all three levels. At the macro level, we need to think about how we can redistribute power and resources, and that can be through providing financial support for people to get involved in research. And then in terms of having voices heard, privileging the voices of people who've often been excluded from decision-making, giving more weight to their voice. And then decolonizing knowledge, actually critiquing what is counted as knowledge and whose knowledge counts most. At the organizational level, the kind of things that we can do are to really improve collaboration with disadvantaged communities, make sure there is some reciprocity in the research process, that we're not just taking from those communities, but actually they have something to gain, and actually making ourselves accountable as researchers, and making sure that if they make recommendations, we go back and report back what we have actually done in response to those recommendations. Having people involved in research teams, we can do that through, for example, appointing people to the team and supporting capacity building using peer researchers, and then also recognizing the social and political context when we analyze our research data and not try to see the data as something that is completely divorced from that, but having that kind of awareness of context. And then at the micro-individual level, capacity development is hugely important, making sure that research questions themselves address the priorities of communities and they're not wrapped up in some sort of divorced way from what's important to those communities. And then facilitating the increase of social capital by bridging, the people from disadvantaged communities with those in more powerful positions. And all that can help to empower people and to improve their ability to take part in research.
I was going to start with some sort of general learnings that I've learned from my work in PPI and in research. And the first one is probably the most important one, which is to start planning the inclusion and involvement that you want to have in your project as early as possible. Ideally, right at the start, before you've even put together a protocol or anything like that, start thinking about how we're going to get inclusion and involvement straight from the start. And this will really help you secure the resources that you need, and you won't be worrying about it later on, thinking, oh, maybe we should do some PPI in the final stage. Another thing is that flexibility is really important for accessibility. So having some adaptability and having some space for change in your protocols and your plans can be really helpful later on in the line. If you realize that someone has a certain accessibility need, if you've got that built into your protocols. And then my final thing is to talk a little bit about some work we did with a young people's group of people aged 13 to 25. And we invited them all together. This was sort of when COVID was, on everybody's minds, and we were thinking, how can we improve our ways of working? And I've got quite a long list here, and I know I don't have that much time to go through, but we had a sort of really good session where we discussed different ways of working that can be accessible and inclusive. So some of the digital technologies for young people have been really, really interesting to explore, like WhatsApp and Slack. Things like voice notes, but then also there's sort of old school ways of doing things, I guess, using newsletters and postcards. So maybe these are sort of things we can talk about a little bit in the breakout rooms, but there are so many ways to engage people, and just thinking sort of broadly can be really useful exercise. So my final slide is just to say, give it your best shot. It's you have to think about things a little bit, but it's not that difficult to do. Just give it your best shot, and it will make your research better for everyone.
The first point that I would like to make is to clarify a little bit the term research co-production. So basically, what I mean by that is the process in which children are given the opportunities to shape the research agenda to some extent and to participate in research implementation. So not only as research informants, as research respondents, but also as contributors to other stages of the research. And later on, I will be sharing some concrete examples in which stages of the research I try to include children and young people. So it necessarily means epistemological shift, that meaning that the children are regarded as social actors and important sources of knowledge, and the new sociology of childhood was kind of initiated that kind of thinking. But it was spurred by the international human rights law, so Convention on the Rights of the Child, it's Article 12, saying that children should have the opportunity to express their views, that adults should create a safe and welcoming space for children to express their views and to take them into account seriously. And I'm putting here also the Convention on the Rights of People with Disability, which is also kind of reiterating this right to be heard, but also mentioning that there has to be concrete adjustments and adaptations when needed of the research process, so that disabled children could take part meaningfully. But let me first highlight the stages in which I included children and young people. So first, I included them in development and refinement of research tools and research methodology. In data collection, obviously, as research respondents, because I'm applying qualitative research, speaking with disabled children, young people, their parents, and health professionals. And later on in data analysis, because I will be taking the interview excerpts and then taking them back to the Youth Research Advisory Board, and we'll be discussing with them like what topics they're recognizing that are important to highlight. And in dissemination phase, I'm hoping to develop with them some dissemination activities to disseminate the findings. Let me share a few words about the Youth Research Advisory Board. So I recruited 12 young disabled people internationally. Basically, we discussed their lived experiences, like what they faced in medical encounters, what kind of barriers, and what is their recommendations that are important topics to be included later on in data collection phase when I speak with their disabled peers. So basically, the outcome of this process is the interview guides that I was using in the data collection phase with their peers in England and Serbia, because I'm doing the comparative research. And just to conclude with a concrete example from data collection phase, well, the way how I did the consent procedure is that I use quite a lot of visuals in the information sheet. So I was sending first to their parents by email the information sheet, all the information by the research, and I was securing first the parental consent, and if the parents agreed to take part, we set up the online meeting to meet the child and to go through the information sheet. And I also found with some children, for example, I also have children who are nonverbal, who are having intellectual impairments. So I use Google Jamboard, and I found that quite interesting and useful, because this is basically the slide and the tool that is enabling you to do the interactive session. So the participant can actually move the objects on the slide. They can color in the green faces. So, for example, in the consent process, like because they can't express verbally, they were either coloring in the faces, or when we did the interview, they were putting some emoticons to respond to certain questions in certain situations that I create also in the slides. So basically, these are shortly some tips and tricks that worked well, but I'm happy to answer further in the questions.
I want to talk about the practical ways that we have tried to make our research project inclusive, and share some reflections, and also share some reflection from my experience as a public contributor. So people need to have a seat at the table if inclusion is to happen. And myself and Joyce Fox, who's the other patient partner, and herself, if we hadn't been part of the COVID-19 PPI group, we would have even started this conversation. So you need to, for your research to be inclusive, you need to actually include people. But we also realised that we needed help and support, and we sought that. So we decided to do the research through the Centre for Epidemiology, and Charlotte Sharp, who's a rheumatologist and researcher, came on board to be our principal investigator. So we were inclusive of researchers in our research, and we like to think that we are equal in this team, but we're different. We wanted to use mixed methods, so it's mainly qualitative, but also asking for people to submit creative materials like Ollie was talking about, whether that be poems or writing or photographs or whatever, because we wanted to ask, how will people want to be included?
What are perhaps the strengths and limitations of routinely collected data? The ethnicity data that we have access to in the UK are based on the categories of the census. So they're pragmatic, they're specific to a particular time period and context. However, we need to recognize that the variable of ethnicity encompasses a large range of concepts, some of which are listed here. And we're very lucky in the UK to have access to these kinds of data across all different government bodies. In fact, in many other countries, the collection of ethnicity data is considered illegal. So we have a unique opportunity in the UK to understand who isn't included in research, and to use these data to identify needs and priorities of different groups. There are, however, some important considerations in using these data for research. And as I mentioned before, the ethnicity classifications are very time and context specific. And in fact, they reflect how particular groups have been racialized, that is, shaped by historical and political forces. And therefore, we need to consider the wider context of how people are shaped by these forces when interpreting research using these kinds of very pragmatic and high-level categories. So I'll end there, just highlighting the importance of high-quality ethnicity data for identifying patterns of disadvantage and inequalities. And though ethnicity isn't a perfect tool, it is a useful proxy for a range of important things. And in terms of routine data, it's kind of one of the best tools that we have at our disposal. Thank you very much.
It's important that this isn't a checklist approach. I think sometimes a systematic approach can be helpful. And I'm going to tell you a little bit about that approach that we've started to use in the applied research collaboration in the East Midlands. We've started to use a process called equality impact assessment. And that's a process which means that we analyse and think about research studies right from inception, whether they're service or policy research or review projects, to ensure that different people's needs are being considered and are being met. And, this is very much about considering fairness, being flexible in the approach that we take to research to ensure equal opportunities for people to participate, to benefit from research, to be researchers as well. The Centre for Ethnicity in Health Research at the East Midlands are looking at this process in terms of widening equality awareness and appreciation of inclusivity, how it affects study design and community engagement, makes use of equality data, considers stigma and discrimination, and just makes us think more widely about fairness and also recognise that there isn't a simple formula to this, that we need to think about every project in detail in relation to all aspects of inclusivity. So thank you very much.